Hello, viewers. Hope all of you are doing truly well. As I keep asking you, I'm of course Rajashree Gadgil, nutrition expert and founder and CEO of TRUWELLTH Integrative Healthcare Centers. And as some of you would know, I have 20 years of global experience in nutrition, nutritional formulations, continuing medical education, and more. Um, Today, actually, we are here with a very important topic, which is very close to our hearts, mind, and the expert we have here with us today, Dr. Girija Wagh. Holistic approach to improving reproductive health is crucial, not only in enhancing the outcomes of the fertility treatments, but it's also important in improving the health of the offsprings and the generations to come. This is why it is so important for not only the doctors and nutrition experts to incorporate an integrative, holistic, and personalized approach in their treatment, but it is also important for the parents to follow the same. When we, rather, the parents to be to follow the same. When we talk about the holistic and personalized approach in reproductive health, there are multiple parameters like accurate diagnosis, treatment, mind, body, emotions, lifestyle, personalized nutrition management factors. Why are all of these actually important? Yeah, and how they improve the outcomes is what we will be learning in today's first episode here on the important topic, which is reproductive health, a holistic approach. And on that note, I would take the privilege of course, introducing uh, the one of the most renowned experts here, Dr. Girija Wagh. She has 3 decades of experience, especially in normal and high risk obstetrics and gynecology, IVF fertility treatments, PCOS, procedures of fertility promoting laparoscopic and hysteroscopy surgeries. She is an MBBS and MD obstetrics and gynecology from the BJ Medical College and Sassoon General Hospital. She has a diploma in advanced gynecology endoscopy from Germany. She is a fellow of the Indian College of Obstetrics, and she's fellow of the Indian College of Obstetrics and Gynecology and the fellow of Indian College of Surgeons. She's a consultant at the Cloud9 of Flow Hospitals, professor at Bharati Hospital, Pune, and runs her own nursing home in Pune, Girija Hospital and Infertility Center. She's also venturing into a lot many more activities, and of course, she will share that with us. She's been the chairman of the Medical Disorders Committee FOXY 2013 to 16, and she's of course a staunch feminist and believes in empowering women through health and really is concerned about the health of women for generations to come. And so, on that note, let me take the opportunity to bring her on the virtual stage. Good evening, Dr. Girija Wagh. It's
Namaskar, good evening.
such a pleasure to have you with us once again. And we have run a relentless series on women health, especially focusing on PCOS and pregnancy for a while. And we both, of course, have been practicing the holistic approach, the integrative and personalized approach in our practice, and we've seen great results. But here we really want the viewers to understand what this is all about and how important it is, as it's getting more and more difficult for women to conceive, and overall reproductive health when it comes to women and men, especially through the pandemic, has also been more difficult. So here we are with you, and before we actually begin with our questions, if you would like to say a few things to the viewers, and we can then proceed further.
Yeah, so Rajashree, I would like to say something very important and much more in context with our session today. Is we cannot diversify or segregate medicine entirely away from nutrition and lifestyle, is my very important mainstay message of especially in context of our session. Secondly, holistic means that you have to consider not only looking at women's health at large, but women's health as a continuum of process, because women are going to be the ones who are going to bear the brunt if things go wrong. They are the ones who are going to carry this brunt forwards to their offsprings and their future generations. So, the purpose of getting together with you outside my usual clinical practice and coming on this stage to connect to the general public at large is to impart this awareness that we have to be not only looking at a particular woman in context with her current health issue that she comes to me as a gynecologist, maybe for infertility, maybe for irregular cycles, maybe for having babies but is not able to retain them, that is miscarriages or any complications, but also to ensure that she not only is healthy now, but she continues to pass on those health benefits to her future generations. Today, the most disheartening thing that we have, if you may just look around and see, nearly 30% of Indian women today during pregnancy suffer from diabetes. And this is type 2 diabetes related to complete issues which are related to lifestyle. The second issue is hypothyroidism. There was no business for Indian women to suffer from hypothyroidism in such large quantity. So, stress compounded by improper nutrition, improper lifestyle is giving rise to these challenges. And then, whole lot of sort of comorbidities, complications during pregnancy. Anemia, if you look at the current NFHS survey, that is the survey which the government of India does to assess health countrywide. And the recent survey has shown that pregnant women still 54% of pregnant mothers continue to be anemic. Can you imagine, Rajashree, the program of anemia eradication is in place for the past over 50 to 60 years. And still we are trying to, tackle this problem. So therefore, when I'm looking at this particular session, I'm looking at it with a lot of purpose, a lot of promise, and lot of productivity, and definitely a way forwards to trying to help mitigate these challenges that are there for women's health at large. And I must really thank you for creating this wonderful platform.
Amazing, and I think this is something which we both strongly believe in. And in first place, what I'm sure you realize that every day in and out, and we all realize that never did we ever think that there's something as a reproductive health. I mean, how many of us really understand that we need to have we talk about bone health, we talk about these days immunity, and we talk about everything, but how many times are we concerned about reproductive health? And so how do we really assess it? What is the age from which women or girls have to start being very sensitive about it? And what should be the methodologies if they should be visiting a gynecologist early in age, instead of after they get married and then they start realizing that there are issues?
So basically, reproductive health has a very wide spectrum, and it is not only something which is related to women, it is also something which is important for the man. And what we are going to talk today is going to be in context of women. So we are going to focus on that. We would be also in one of our sessions talk about men reproductive health too. But at this point, let's focus on women. Now, as we know that all living beings, and women especially, are the ones who are important and vital to have and make babies. And these function of the woman's body is extremely vital because finally we are human beings who are alive, who have to continue the race, and the race has to be born healthy. We cannot just have many babies going to the NICU, many babies having birth related issues, many babies having growth issues, because if you now currently look at what is happening on the global front, today a lot of talk is happening about the first 1,000 days of life. And these 1,000 days, the 270 to 290 days are first in the mother's womb. And they have extended this beyond that before woman becomes pregnant, the 3 months preceding also are extremely important because it has been found that if the woman is not healthy, this can adversely influence the babies who are born and even her own health. So when you are talking of reproductive health, ideally it starts from with the beginning of menstruation, and it ends with the cessation of menstruation. That would be a typical landmark which you can identify. So when a woman comes of age at around menarche, when it is between 12 to 15 years of age, when she starts menstruating, her potential to be reproductively functioning is identified. Then, when she goes into complete cessation of menses for a period of 6 months, that is again understand in retrospection, and which would usually occur in an Indian woman around 45 to 50 years of age, that would be the time when she will become menopausal. Now, the ideal point in time when you can actually function optimally for reproduction is from the age group of 20 to 35 ideally. We can extend it to the age group of 40. Now, why? Because after 32, the biological clock of the ovarian reserve, because ovary is a wonderful organ in a woman's body, 1 into 2 into 3 centimeters in its entire dimension, but gives rise to a lot of hormones, eggs which are produced. And this has a limited lifespan. So that's its activity gets triggered at around the beginning of the menstrual life, and then it would cease gradually when she becomes menopausal. But a drop in the efficacy of the ovary to function optimally to be able to make hormones and eggs would start at around 32. However, women would have a potential of getting pregnant by till the age of 40, and this is very vital today to understand, because many women embark upon making babies a little late in life. Career has become important, maturity, financial stability, social identification, all these things are mattering. And therefore, all the more Rajashree become important, that we identify that if we have to maintain our ovarian health, means we have to maintain our reproductive health. Just you'll be worried about your bone health, your bones becoming weak. I would focus that my ovaries have to be strong. That is how women should look at it when we are seeing optimizing reproductive health. So anything that is going to challenge the ovarian health, be it your lifestyle, be it your circadian rhythm, you're not sleeping on time, be it your exposure to any kind of screen times, or it can be lack of sleep, it can be lack of physical activity, obesity, so many other disorders which are going to challenge the ovarian health, are going to challenge your reproductive health. So if you ask me in one single word, madam, what is reproductive health? I would say it is equivalent to ovarian health.
Bang on. I think that's something which you're completely driving our attention towards this internal organ, which most women do not realize until you really come to that situation when you start facing so many issues. And the issues that we face are really plethora of them, and that is something also what we would like to understand from you, because there's always that matrix where they'll be having PCOS, they'll be having obesity, diabetes, like you mentioned earlier, all those issues, thyroid, all of them come together. A lot of them also at times you've seen these days are suffering from digestive issues. So all of them really come together. So how does that really actually make treatment, and if there are any surgeries, how important it is to decide what the treatment should be, and how, I mean, there must be a lot of integration, understanding, analysis, including diagnosis. So how do you normally go about it so that the results are much better?
I will make it very simple for you to understand. I understand because we should not get into too much of scientific jargon, which can become very difficult for people to understand. The simple thing is, your ovary requires some very important stuff. It requires good rest. It requires good nutrition. It requires good blood supply. Now, just take an example. For example, I am a working woman who has to work in the office, let's say from 9 to 4. Hmm? And this is where I am probably now doing it from Zoom, let's say 9 to 6. Let's expect 9 to 6. extend it a little more. And I'm going to sit on my Zoom all the time, the entire day I'm sitting here. All my body has become sedentary. I'm sitting and eating something. I feel hungry in the middle. And then because I get so fatigued, I do not even take proper diet. I get up at 8:30, just change, sit in front of the Zoom. I finish it at 6 o'clock, and then I just laze around or just do something else. There is no physical activity, there is no proper food, there is no proper nutrition, and constantly I am under stress. There are catecholamines, there are no good antioxidants going to you, there is no good blood supply to the ovary conks off. Now, what happens to this ovary? Ovary is supposed to be the moment it starts secreting abnormal hormones. That means the woman's cycle becomes irregular. Whole lot of women come to us today with irregular cycles, and sometimes I feel women are very, very lucky, Rajashree, that they menstruate, because their menstruation irregularity brings them to the doctor. I have just had about 1 or 2% of my patients coming to me saying, Doc, I'm putting on weight, please help me. Nobody comes for that. They would say, my menses have either I've missed my menses, or I'm having painful menses, or I'm not getting these menses on time. So that brings them quite early to us, and that helps us in seeking out what is the problem. Now, irregular cycles means irregular ovulation. Now, we know to become pregnant, we need to have a good ovarian function. So, your ovary has to be able to release eggs properly. If your ovary is not able to release eggs properly, it's not able to produce hormones properly, then how is there going to be the entire gamut of there being correct hormonal milieu inside your body, inside the vagina where we are going to have sex, the cervical mucus, which is going to be helping the sperms to come inside, the wonderful the mobility of the fallopian tubes, where the egg and the sperm are going to meet each other. And then the fertilized egg is going to come back into the womb and is going to get stuck to the womb, and that lining has to be formed correctly. All this will be get determined by the woman's hormones. Now, many challenges happen. So you ask me what tests we do. The first and the most simple test is we do a general examination of the patient, wherein we look at her lifestyle, we look at her, what is the irregularity in her cycles, whether she is having any telltale signs, like if she's having abnormal growth of hair on her body, is she having some pigmentation anywhere? Is she having any signs suggestive of hypothyroidism, PCOD, or hyperandrogenism? So these are the three commonest things that we look for. And then we also do the general assessment where is she having anemia, whether she has blood pressure complications, whether she is hypothyroid. So certain lab tests have to be done. It's not only like doing Nadi Pariksha physical examination. You have to listen carefully to the history. You have to analyze their general health parameters, because they are going to get into a very important responsibility of having sex, getting pregnant, and delivering that baby eventually. And then additionally, a simple transvaginal, that's an internal sonography, is ordered usually, wherein we get to look at what is the problem there. Sometimes there can be signs on a sonography suggestive of polycystic ovarian syndrome, or there are certain disorders like endometriosis, which cause painful periods, but they can be detected sometimes on sonography if it's done with a good high resolution sonography machine. And then there is a simple test, everything seems to be fine. Then we can do just by an X-ray, it's called an HSG, that is hysterosalpingography, wherein a dye is injected into the genital tract, and then we see whether the tubes are open or not. So these are very basic things. Some lab tests help us in understanding the hormonal milieu. Some tests help us in understanding the metabolic milieu, like fasting insulin, any vitamin deficiencies, any hyperhomocystinemia, which can be a challenge because women, you will make them pregnant, let's say by ovulation inducing medicines. But what if they are not able to retain that pregnancy and land up in a miscarriage? So therefore, a holistic analysis has to be done in the woman's health. Now, if we find any clue or a problem, like she's having a PCOD, which is of a very severe degree, or if she's having a HSG showing a tubal block, or maybe there is a disease which mandates that you go in and see by a laparoscopy. There is an interventional, it's a little interventional because you have to take the patient under anesthesia. You give her anesthesia, you pass a telescope through the belly button, and then directly visualizing the inside, which is called as diagnostic laparoscopy, from where you see the uterus, you see the structures around the uterus, you see the ovaries, the fallopian tube, their relationship, if there is any blockade, if there is any disease there. So these tests can be done. So that is the final step usually in the diagnosis. At the same time, even the uterine cavity is seen by a small little telescope which is called as a hysteroscope, which is passed into the uterine cavity, and that helps us in analyzing whether there is any problem in the uterus where the baby is finally going to get implanted. So these are the smalls and the bigs of analysis. I am not discussing about the man's diagnostics, but parallelly, even men have to be analyzed. Usually, the man is analyzed by looking at their semen count, or there are so many other important histories that we ask even in the man's condition. And I hope that sometime down the line, we'll have a special session trying to analyze the man's fertility issues better. So today we'll focus on what we do for women. So as I said, basic proper history, general physical and clinical examination, a sexual history, anything in the past, any medical conditions, any surgeries if she has undergone. Now I'll tell you an example of a woman who had undergone appendicectomy some time back. And that time she had severe appendicitis, and for that it was an emergency surgery performed. And then she was undergoing treatment for infertility quite a lot. I said, let me look at your sonography first. And then sonography, there was tenderness. I said, let's go and see and do your let's do a laparoscopic evaluation. And we found that the tube on the side where the appendix was done was stuck. So we had to release it. The moment it was released, in 2 or 3 months after that, she conceived. So, these are things which are decided as to, it's not going to be one after the other. Ye karne ke baad ye karne ka, ye karne. The doctor decides whether, like in this patient, you can see that I immediately jumped to do a laparoscopic evaluation because we should not lose valuable time. One of the important things that we have to remember is the biological clock is ticking. So we cannot just keep on trying. We have to understand how much am I going to analyze this patient? When is she going to, how long are we going to give her ovulation induction medicines? How much time she's going to require? Now, so many times I refer patients to you for, I want quick weight loss because I want to ensure that their weight loss occurs little faster, swifter, so that I can plan their pregnancies better. Because one of the things, Rajashree, we have to understand that even abnormal weight causes challenges in ovarian health. And I have had an experience where if the woman has a wonderful lifestyle change and if she really loses weight and takes proper diet, nutrition and everything, their AMH, which is a marker of ovarian reserve, improves. And I have had patients becoming naturally pregnant just by changing lifestyle. Just imagine, AMH, which is found to be less than 1, tells us that this woman has very, very less ovarian reserve, and possibility of not getting pregnant naturally may require stimulation or may require even IVF or artificial or assisted reproduction technique. But I have had series of women who have listened to me, thankfully. Some of them have taken help with you and they have conceived naturally just by lifestyle change. So there is so much that you learn from the field. There may be a dogma written out of research, but finally what we experience in our practices also matters. And this has been our experience.
You did really answer most of my, especially my next question, which I was to ask you what are the results that you've seen, and of course I know of it, and we've also, like you said, dealt with a lot of the issues women face, and on that note, because a lot of them land up asking me what should they eat, and that's always the question. So I'm going to try to address that maybe with a few slides here, and then of course I want to take more inputs on the same from you, so that the viewers really get the both the clinical and the nutritional understanding, not only just from the standpoint of we keep telling them have balanced diet, but what exactly do they need to do? So allow me to share a few slides
While
here.
you're sharing your slides, definitely I would like, and I, you know, that I'm always very domineering on you and telling you certain things. You know, one of the things is women do not understand, and that's my challenge in my practice, which you should help me deal with, is they do not understand the difference between good fats and bad fats.
Yeah.
They do not understand the difference between good carbs and bad carbs.
Yep.
They do not understand the importance of protein. And most importantly, today, Rajashree, there is more than enough research which is saying that if you take loads of probiotics and if you take loads of fibers, fruits, salads in your diet, that helps in reducing the possibility of blood pressure complications, hypothyroidism, and diabetes, which is my challenge in my
Yes.
clinical practice. So, on to you.
So I am today going to touch upon exactly these points, and like you said, as we do sessions further, which we will go into more cases and details as to how every patient is different, and we will take more of these, especially like you said, lipids and fiber. These two things, and probiotics, where they also need a prebiotic fiber. We should actually address those issues, those good points as well, and uh, get the viewers to understand, instead of just talking about having high fiber diet. It's really important to know what are the different fibers, what are the different of fiber that exist, and what is good for them and what is not good for them. So quickly to touch upon, this is my favorite slide every time. It's like we have to understand that we are phenotype, that is we are made up of the genes, environment, and nutrition. Genes is something which we have got from our mothers, and that's why it's very important, because we can't change it. So it's the onus is on us, that what are we going to give to our next offsprings, and what will determine our phenotype is going to determine their genotype, remember. So for that, it's very important what environments we are in. Today we know that environment is something which we cannot change, absolutely cannot change. In this pandemic we have realized that. But even then, in the given environments that we are, what we can really work on is what we eat, and nutrition is so important. That's why in these situations have made us realize it more and more. So understand nutrition. That's why it's important. It's said that nowadays people also say that it's not just 70% but up to 80% of nutrition, but 70% of it is 70% of nutrition and 30% of workout. But when we say 70% of nutrition, that doesn't mean that we can just not work out. 30% of workout is extremely important, and this is something which I have realized in my practice, that women do not realize what type of workout and how much of workout is needed, when is it needed. So all these two parameters are extremely important, and the third most important aspect is what I've seen women, or all of us really, are suffering from, is insomnia. So we do not sleep well, and if we don't sleep well, then we are naturally not going to be able to exercise better. Neither are going to be we're going to be able to eat well. So it's extremely important. And when it comes to reproductive health, of course, performance, vitality, energy, these things become very, very important. If we have to make sure that we are not only going to take care of our own health, but of course of the health of the baby. So this is extremely important. And what I want to focus on is taking, like ma'am said, and I reiterate that taking a gynecologist opinion way beforehand, not just few months before we decide to now we are going to conceive, is very important. Visiting a gynecologist is equally as important as we visit our other doctors, like our dentists, our physicians, to take a general understanding of our overall health. So it's extremely important to visit our OBGYN, and also take nutritional expert guidance when you don't need it. If you take it, that's the most easiest way to do it. But if you land up in a situation where now you can't do anything, your lifestyle is bad, your weight is up, it is very important to take an expert guidance instead of just trying to follow what's available in social media. What works for one may not work for the other. So it's extremely important that personalization is done out here. And of course, we have to have a healthy nutrition habit. Ma'am keeps telling this to everyone, and I keep telling that to everyone. Weight management is important. It's weight management. It's not being skinny and bony. You have to have the right weight. You at the same time should have the right muscle and bone. So building it is extremely important. Weight training is important ahead of time, not when you're trying to conceive. It can be risky, but weight training is important because finally, when you're going to get pregnant, you're going to bear the load, and you have to be strong enough to be able to do that. And this, of course, is going to be extremely important for our bones and muscles as well. So, and otherwise, of course, managing the conditions like PCOS, diabetes, thyroid, obesity, we see so many of these diseases overlapping in our patients. So, get your attention to it, and moreover, it's also very important to build psychological strength and health. So, these all parameters to me are important when we are talking about reproductive health. And of course, with that, we all talk about balanced nutrition. We all know that we're supposed to eat half plate has to be vegetables, fruits, and the remaining half has to be whole grains and healthy protein. How many of us really land up doing that? We all know this, and we know what constitutes it. That's why it's very important to take the right guidance, and that is why, based on what our patients are, understanding their complete situation, we actually design meals for them so that it becomes very easy for them to follow. At the same time, they do not miss on maintaining this balance. Like ma'am said, healthy oils are important and hydration is important as well. So when we talk about balance, I always talk about alkaline and acidic foods balance. This is very, very important. It's very important to refrain from alcohol, coffee for women who are trying to conceive, and want to have a good reproductive health. These have become very common these days, so we have to make sure we can stay away from them. And while we're consuming a lot of acidic foods, which comprise of a lot of proteins, it's important that we also have neutral foods that we are eating with it, which comprises of good fats, of course. And however, processed sugars is something we should stay away from. Instead, we should balance it out with low GI index carbs. And of course, alkaline fruits, nuts, legumes, vegetables are extremely, extremely important. And I'll tell you why in a bit quickly. But make sure that our micronutrient balance is there, and we have to start ahead of time, making sure that all deficiencies are corrected, because Girija ma'am spoke about the antioxidants role, and it's very, very important. So also vitamins are very critical for uptake of nutrients. So listen into what your gynecologist is telling you, and as well as your nutrition expert is advising you. These things are extremely important. Also, it's important to correct digestion issues, because that is where when you can uptake the nutrients that are needed in today's times. All the essential nutrients uptake is important, and the immunity nutrients also need to be properly taken in these tough times. So make sure you're doing that, because uh, you will face a lot of digestion issues later when you get pregnant. So we need to actually correct all of this before, ahead of time, and that's how we build our reproductive health. And you mentioned, ma'am, about proteins, and we have to understand that proteins break down into amino acids, and these amino acids are critical for hormones, enzymes, and antibodies in our body. Hormones, if we are not able to maintain a good hormonal balance, it can be a chaos. Plus, we require energy and muscle. So energy, muscle for our strength, and hormones for keeping the balance. For that, we need to take proteins from different sources. Understand that only non-vegetarian is not enough. You need to have dairy, you need to have plant. All of that has to be in a proper balance. And if we get amino acids from different sources, then what really happens is that we are able to get all these different crucial amino acids. And if you're not able to get it, don't shy away from protein supplements, but take the right advice while you're taking them again, because they could contain unnecessary ingredients which could be harmful in pregnancy. So it's important that you get these crucial amino acids for energy, bone muscle strength, growth, building immunocompetence, hormonal balance, and of course the growing needs. They have to be met. So complementation is required because more amount of protein is needed, and we have to make sure that we are able to digest this protein. So that's extremely important. And why are these kind of diets very important? Because we keep talking about oxidative stress and chronic inflammation, which exists in everyone today. And the younger women are having these issues because of the lifestyle, work cycles. They have to balance so much in life, in their careers, and land up eating wrong foods and having long hours of work, etc. All this can actually give an increase to can land up increasing the chronic inflammation and build up oxidative stress in our body. And we will go over these details in our coming sessions, what inflammation and oxidative stress is. But do understand that these are two critical elements in our body which we can correct by keeping ourselves hydrated well, recharging ourselves well with vitamins, minerals. Make sure we also take electrolytes and antioxidants along, so that we feel well energized. We have antioxidants in it which can actually remove the harmful effects of free radicals that are there in the body. And these things are, they cannot be seen from outside, but these are the ones which are important. Which is also in the same light, it's important to have foods with low GI index. And there are so many charts put out on the internet, but it's important to understand which is the right one for you and which you can easily consume. So it's extremely important to have a low GI index, that is the glycemic index. The carbohydrates that we're having should be complex and not processed sugars like the sugar we eat today. And there are so many corn syrups and so many of these foods that we get ready made. Make sure we stay away from them. Eat good amount of vegetables and fruits. Again, very very important, because they are good sources of antioxidants and good sources of fiber. Again, the fiber that is there in these vegetables can improve our digestive health, and can also give us fiber which can act as a prebiotic, so that good bacteria can actually live up in our intestines and can improve our, not only our gut health, but also can improve our immunity. And it has several other benefits, which include, of course, they take care of lipids, they take care of help a lot in diabetes, hypertension. So these type of patients also it can help. So and then we go to the fats. Don't shy away from fats. Understand what, so we say fats on fat is because it is very important to know which fats are good. So fish, we have avocados, we have olive oil. But again, oils, we have to understand, if we fry foods in these kind of oils, they can be detrimental. So you use less amount of oils, but at the same time, these kind of oils, olive oils, avocados, fish, nuts, a lot of almonds, flaxseed is what we can eat. And if we are able to eat these raw, they are in the best condition. If you use once used oil, that can actually be the most detrimental thing for you. So do not reuse it. Butter and then bakery has to be completely under control. So unsaturated, we have to make sure that while we take the good unsaturated fats, the bad saturated fats have to be kept away. And trans fats, these days we have a lot of mention also on our packages, and our whatever we eat, we the ingredients talk about the trans fats. So make sure you're reading the labels while you're eating your foods. So these were my inputs, and I strongly believe, ma'am, that having a personalized diet is what we do. Without understanding your patients, and without understanding the gynecologist's perspective about the patient, and what is the kind of treatment the doctor is going to give, there is no point in just giving random nutrition. It has to be combined with your therapy. Only when we can get better outcomes and results. And it's so critical. It may sound very philosophical, but it's really a mother's responsibility to make sure that she gives birth to offspring which is much more better in terms of a lot of things that you and I keep talking about. So, really over to you. I mean, you've seen so many results. I mean, of course, nutrition, lifestyle, and also fitness. So, what are your views on it? Because you relentlessly keep telling your patients and giving them some tips and tricks as to what they can follow. So, any of that you would like to share with us?
See, I'll tell you an example of one patient, okay, and then I'll give you an important lifestyle example.
Sure.
One of my patients who was a very young woman, and she wanted to naturally see what is infertility is the time when the couple wants to have a baby and are unable to have a baby. Now, this particular couple had been trying to have baby for the past 2 to 3 years, and then she also underwent in one of the previous doctor's hands. She underwent a septal resection. She had some septum in her uterus, and that was resected by hysteroscopy. And then she was also told that she has some ovulation dysfunction because of a polycystic ovarian disease. She came to me, and they couldn't get results. They tried a lot of measures of ovulation induction, then intrauterine insemination. Now, these are some things which we'll discuss as we go by in our sessions to understand these things better. And despite that, they could not make a baby, and they were quite perked about it. And she was also suffering. She felt that she's suffering from side effects of those medications like constipation, then pain around the place from where you pass stools, and then she used to have a lot of painful stool passage. And then she came to me. She herself was a nutritionist, actually. I must tell you that.
Wow.
And then she used to say she came. Somebody had referred her to me, and then I sat across and spoke about it. And then she told me that anger spells very fast trigger kind of a person. So I first told her to be calm about that. I said, uh, first be a little calm down and take things in their right perspective. And she was young in age, so naturally she had a good ovarian reserve. And one of the things that I observed her, I said, see, you have swollen ovaries which look like PCOD, but you do not have any characteristics of PCOD. Let us get your labs analyzed. And we found that she had very high insulin resistance. And she was not a diabetic, but if that insulin resistance would persist, so that means that your physical activity is not adequate. That means your diet is not adequate. That means your stress levels are high. So the moment we put her on, you know, Rajashree, she conceived after about 6 months of this lifestyle change. Unfortunately, it so happened that around 6 weeks down the line, it was sort of a late conception and things like that because her dates were not matching, and she started having bleeding, and that pregnancy had to be terminated. It did not last. We were both of us naturally see along with your patient, you also go through a lot of suffering. So then I said, and that while I was evacuating the pregnancy, actually there were tears in my eyes because obviously grossly it looked normal. They opted not to go in for any microarray or further genetic testing, taking into account the fact that both of them were young in age. So we decided, okay, fine. And then after 6 months, she said, now I'm going to take it very seriously. And believe me, she conceived naturally after 6 months. And she, till date, she is now celebrating her 8th or 9th baby's birthday. She keeps on telling me, Madam, it's only because of the fact that you were so persistent and insistent on my lifestyle change. And that only has given her the confidence now of becoming a mother. Just imagine. So these are small things. You may find them very easy. Normally, Rajashree, when we talk of diet, when we talk of lifestyle, when we talk of obesity, we always feel extremely offended. Offended ही लगता है सब, because there are 110 reasons which you have to give to say why this happens. So this was one component and an example I wanted to give you. I have such thousands of examples which I can give you as we go by. You only have to remind me, not that I'm not repeating the same story again. There are many more which I can tell you. I remember your father telling me that you must write all your, examples in a form of a book. I don't know, sometime down the line I may do that. And then the other thing is about the history of diabetes, which I want to put forth to you. What happens is, all of us as Asians are programmed to diabetes. Each one of you, me, everybody. Genetically, we are programmed to diabetes. So the moment our genes are used to having lack of food, so we are supposed to be living on less food, on less, sort of paucity of food, and suddenly there is abundance. Not only abundance, there is abnormal kind of food behavior. So we eat all kind of trash which our genes are not able to process, nor are we needing those many calories, nor are we giving good oxidative environment for our functions to occur. And then somewhere down the line, because of these genes which are making us liable and the lifestyles, we start developing type 2 diabetes because of the various lifestyle and environmental issues around us. We become pregnant, let's say, on the same milieu. If diabetes didn't hit you till now, you become pregnant. The insulin resistance of pregnancy now makes you diabetic. Now, while that baby is sitting inside you, you did not have diabetes before. Nothing happened, but you, during pregnancy, you decided to have a sedentary lifestyle. You started putting on weight which was not supposed to be the optimal weight gain. And then all that high insulin resistance milieu inside your body started programming your baby to diabetes. Babies will start growing fat. They will be born with very high composition of fat, leptin in the cord blood. And this is a study, the HAPO study, which has been done in the Caucasian population. We have worse issues than those in the Asian population. And then we have babies who are born, not only they are high weight, even if the baby has optimum weight, still the baby will have increased fat composition. Now, this baby, if it's a girl baby, it has a high possibility of developing PCOD and going into the same circle of becoming a diabetic and then becoming a mother who is going to land up with obesity. If it's a boy baby, the boy baby will have challenges of obesity, then sexual dysfunctions, and then metabolic diseases, hypertension, diabetes in very early age. So somewhere we will have to break this cycle. What does the doctor simply do? Ask for your family history, whether you have diabetes or not, and then analyzes you. Today, no woman should say no for laboratory tests. That's my thing. Because if you have to diagnose your conditions early, like if you want to diagnose diabetes before diabetes sets in, you will have to do lab tests. If you want to know hypothyroidism before it goes out of condition, you have to do your screening test, lipid profile, your micronutrient deficiency. We have access to care. This doesn't mean that the doctor is trying to make money by doing these tests. How is the doctor going to analyze what is your problem without you do those tests? So laboratory testing has been devised for us. And mark my words, Rajashree, 10 years down the line, my sons will be in practice, my students will be in practice. They will stop asking these histories. They will just go, do some genetics test. They'll say, ये tip of the finger, ये test करो, फिर मुझे पता चलेगा तुमको आगे जाके कैंसर होने का है, हार्ट अटैक आने वाला है, तुम्हारे स्पर्म्स में क्या इश्यूज है, वो सब वो होगा. That time we'll have to be ready with money only, nothing else.
I mean, I'm glad that you point this out because the tests again is something which people feel that why they are told so many tests, and those tests then reveal there are so many deficiencies, there's so many overlaps because it's such a deadly metabolic syndrome that women are facing, and you and I have been seeing all sorts of complications, and sometimes, like you said, it's extremely disheartening to see all that, and you put your heart, mind, and soul in taking them out of it. And
see, you just answer my one question. When I give you a patient who has all certain abnormalities or specific abnormalities, doesn't it become easy for you as a nutritional expert to give a proper focused advice to that person?
Absolutely yes, because another thing people do not realize is that when they see all these different charts, if a woman has thyroid along with PCOS, the whole meal plan changes. And if you're just trying to reduce weight, there are so many easier techniques. But if they are going to have, if they're going to have an IBS along with it, or if they're going to have vitamin D and B12 deficiencies, then our whole meal plan is going to change. So it's very important to have these tests in hand, and without seeing those tests and analyzing the situation in totality, there isn't any reason, to give a, it's not very easy to give a personalized diet. And until unless, like you said, people have been eating so many different things. If you do not give a personalized diet, which will actually reverse the bad nutrition that they have been eating, only good nutrition can actually reverse the bad effects of bad nutrition. So that is something which, again, I want to say another thing is people don't want to eat supplements. What are they going to do? I mean, if you have been eating bad fats all the time, fried stuff, burgers, and vada paos, then you have to eat good fats in larger amounts to be able to negate those effects. So it's very important that at times, if you have to up your proteins, it's not very easy to up your proteins by eating plethora of things. Your body won't be able to digest it. So understand that when you're getting the right advice, it's very important, and very important to keep a balance between the nutrition plans and also the nutritional supplements, or the nutraceuticals I call them, are very extremely important. And this is another session in itself. We are almost close to an hour.
I was tempted to give an example, but I said I'll keep it for my next session,
Yes, yes,
where we can see how nutritional reversal has also helped in improvising infection-related issues in women. So
yes.
that we will also take some later date.
And I think what we are going to do, viewers, in this series is that we are going to take more real life examples here and share them with you, and how we both how ma'am has been analyzing so many of them, and then what could be the what has been the right thing to do in that, and that will help you understand things much better in different scenarios. So we will be coming up with more of these programs in our coming up series, and this is a very vital important topic, which is reproductive health. So we all talk about different sorts of health and different organs, but when it comes to our uterus and ovaries, we need to understand how the reproductive health can be maintained, of course, in women, and also we will be addressing the same in men. So with that, I think we'll come to the end of the program with some closing remarks from Madam, of course.
Yes, I would like to engage more and more audience through this program, only with the purpose of increasing awareness, because I feel that the skills that I have experienced, the skills that I have got, I have acquired, and I have learned through my experiences is something meant for the betterment of human race. I feel these are gifts of God, and they have to be put to good use for the betterment of humanity. My ultimate dream, and you are aware of this, Rajashree, has been that I have to help women to not only optimize their health, but I am in the business of building the future of society. And if my little pinch of a contribution to this entire vast ocean of trying to modify women's health and then get optimal results and contribute to creating a healthy future society, I think my purpose of life would be served. And I want to therefore be extremely grateful to you time and again that you have tried to connect to me, tried to get me onto this platform, which will help me to deliver what is my absolute, very, very basic and extremely close to my heart goal and aim and objective of my existence as a professional and a knowledgeable gynecologist. Thank you so much.
Well, while I thank you very much, I want to again reiterate the same thing, that viewers should realize that these programs are something which we purely do it for educational purpose, and try to, we really very much feel it from the bottom of our heart that women should have good health, and their offsprings too should have good health. We are taking additional efforts along with our busy schedules, trying to put together the outlines, making sure that we have the right content delivered to you. A lot of times we make all of these slides, we are we are forwarding as much of these links, and the whole idea behind it is to make sure that we spread the right awareness and reach the right awareness to more and more women to the nook and corners. So help us share our videos with as many as possible, and if you can, do like our videos as well. This is a request because we are taking that effort for collective good of women. Thank you very much, viewers, for joining us, and can't thank you enough every time, Dr. Girija Wagh, madam, for being with me all the time on enhancing and improving. Our purpose and goal of life is very much the same, to make sure that women health goes on improving more and more. So with that, we'll come to this end of this show, and I'm going to, of course, play a short video of in RSG Energia, who keeps supporting us through all these different programs, and they have been relentless in making flyers, also promoting our programs to on different channels, and have really done a great job in the last 1.5 years with more than 300 programs. So proudly sharing their.
Congratulations.
Thank you so much, ma'am. And we continue. We will, of course, be back with our program again for the viewers. Thank you so much. Goodbye, everyone, for now.